Hello and welcome to today's webinar, Improved Outcomes for Cellulite with Z Wave RF Combination Therapy. This webinar is presented by Zimmer Aesthetic Division. I'm Regina West and I'll be moderating the webinar today. During the presentation, you may submit questions by typing them in the Questions tab on your webinar control panel. Following today's presentation, we will cover those questions live. If there's not enough time remaining for all of the Q&A, answers to your questions will be emailed to you. I'd now like to introduce the speakers for today's webinar, Dr. Sarah Sawyer and Master Medical Esthetician Michelle Alvis. Before handing it over to them, I'll give a brief summary of their backgrounds. Dr. Sarah Sawyer is a board-certified fellowship-trained dermatologist. She obtained expert skills in general dermatology before seeking further training in cosmetic dermatology, laser surgery, and skin cancer therapy. She graduated with honors from the University of Alabama School of Medicine. She then completed a dermatology residency. During that time, she became involved in research, authored medical papers, lectured nationally, and held multiple leadership positions. She later completed a fellowship where she was mentored by 4 of the nation's leading dermatologic surgeons. Since 2006, Dr. Sawyer has operated Dermatology and Laser of Alabama, providing treatment with the state's largest collection of lasers, Z Wave, cryolipolysis, ultrasound, radiofrequency, and other devices. Michelle Alvis is a master medical esthetician and laser technician. For 12 years, she's worked with Dr. Sawyer at Dermatology and Laser of Alabama. She specializes in body sculpting using techniques such as Z Wave, Vanquish, CoolSculpting, and Excellis. In addition, she's experienced with skin tightening using other laser, energy, and light-based devices. If you're just joining us, I want to welcome everyone again to Improved Outcomes for Cellulite with Z Wave RF Combination Therapy. Dr. Sawyer and Michelle Alvis, thank you so much for being with us today.
Thanks for having us.
Okay, I'm now going to give you control of the presentation, Improved Outcomes for Cellulite with Z Wave RF Combination Therapy. Give me just a moment and we should be able to see your screen. Okay, Dr. Sawyer, we're seeing your screen now.
Okay. Hi, everybody. Glad that you could make it onto the webinar, and thank you to Zimmer for inviting us tonight. We have a busy body shaping practice in Birmingham, Alabama that we started back in 2010 with the purchase of our Excellis. At the time, it was just Excellis. Now we've got the Excellis Ultra. But over the last 9 years, Michelle Alvis and I have kind of grown up in this realm and checked out and purchased a lot of equipment. That equipment has returned about 10x on our investment. So we feel like body shaping is a great thing to add to any practice. And certainly the Z Wave by Zimmer has added immensely to our body shaping practice. The primary reason that our body shaping practice has been so successful is the woman who is on the webinar with me, Michelle Alvis. She's a master medical esthetician, and she is truly a magician with our devices. When we purchase a device, she digs in obsessively and puts so much time, thought, and effort into developing protocols so that our patients can get the best results possible. She's also the one who has mixed and matched them as we've gone, trying things here and there and discovering that combinations are always better than single therapies when we're trying to sculpt a body and give the best result possible. She's also an expert at patient selection, and through the years, we've seen that this is probably one of the most important parts of success. So whether you're just starting a body shaping practice or you have a body shaping practice that's even bigger than ours, you know that patient selection can make or break you. So we have a frank discussion with everyone that comes in. We are not very salesy. Now, while we do show pictures and show what's possible, we also have realistic conversations with patients about their diet and their exercise, along with the limitations of our technology. And I feel like that's important, and that's one of the reasons that we have such happy patients is because we're not ones to overpromise. So tonight we're going to be talking about how we've combined Z Wave with our radiofrequency devices to give great results. So what is Z Wave? It's extracorporeal shockwave therapy, also called radial shockwave therapy, but it's basically it's referring to shockwaves that are generated outside the body. The technology was used initially in physical therapy to mobilize edema after trauma or injury, and also to build new collagen and blood vessels when it's used over time. So essentially it's used to clean out damaged body tissues and toxins and to generate more blood flow to an area, which rejuvenates the area, whether you're trying to heal it or just make it look and feel healthier. So naturally, this was a perfect fit for Cellulite, and that's where they got their initial FDA approval. So there are lots of reasons that we develop cellulite in the body. Fat is part of the issue, but it's not the only issue, because everywhere you have fat, you don't have cellulite. But we know that the fat lobules in the area are enlarged, but also fibrous bands form and tighten between the fat septae as the collagen fibers become more rigid and the skin becomes less elastic. But a lot of this all comes down to blood flow. So we know that blood flow and metabolism in cellulitic areas is compromised, so that metabolic waste accumulates and toxins. So when the toxins build up, that creates more fibrosis and so on. So it's really a vicious cycle in the area. So Z-Wave really answers every aspect of cellulite formation by creating increased blood flow in the short term with the massage and in the long term via angiogenesis. The increased blood flow helps wash out toxins and loose fat cell contents, triglycerides, or the fat cell metabolic products. It also speeds local metabolism of dead fat cells, and it helps repair collagen and enhances the return of elasticity to the area and the firmness to the skin. So these are from some 2012 journal photographs from an article by Pablo Naranjo, who's a Spanish physician, who showed with ultrasound the changes after 10 treatments on the right thigh of a patient with cellulite. So the top image is an ultrasound of cellulitic skin prior to the Z-Wave treatment, and you can see that there's fluid accumulation, there's irregularity at all layers, and enlarged fat cells. Then you can see in the bottom picture after 10 Z-Wave treatments that all the layers are smoother, the fluid accumulations are gone. And then in this really good photograph, this was done with thermography, and it shows blood flow. And you can see this is the same thigh with thermography showing the blood flow. And so you can see that after 10 treatments, blood flow increased substantially. So there is a cellulite severity scale, and it is, so basically we measure cellulite by having the patient stand and then lie down, and we can also do the pinch test. So you can see there's stage 1, stage 0, stage 1, and stage 2, and there are higher stages, but these are the stage 1 and stage 2 are the ones that are going to do the best with therapy. So this is a patient of ours. This lady was treated last spring. She was on a weight loss diet, but still had lost quite a few pounds, but still had cellulite on her thigh. And so over 8 weeks, we treated her 5 times and got this outcome. She was thrilled. So just like we do with every new technology, practitioners always grab it and figure out what else to do with it. And so even though there was no FDA approval, we those of us who have CoolSculpting saw the benefit of Z Wave very quickly. And So early on in CoolSculpting's life, we were told to massage with hand massage after CoolSculpting. Well, the tissue was so cold, and anybody doing the hand massage got frostbite on their fingers. It was very difficult to massage. So the Z Wave was naturally something that we grabbed and gravitated to after we saw that hand massage was good. And what we all saw across the board was at least a 10% improvement in the results, and that with the normal time frame of seeing a result after CoolSculpting at that point was 3 to 4 months, but the result came much more quickly. And the very first time that Michelle and I tried this on a patient, we treated one side of her flank and didn't treat the other side, and got vast differences. So we knew then that we needed to have it. We have 2 CoolSculpting devices, and we never perform a CoolSculpting without doing a Z Wave immediately afterwards. Michelle also is now occasionally doing Z Wave prior to CoolSculpting, so that she can get better tissue draw, because it sort of softens the tissue. And those of you who have a CoolSculpting machine know that tissue draw is a big deal in the result. So that the better the tissue draw, the smoother the result, and the better the result. This is another patient that we treated just 2 times with the CoolSculpting and Z Wave immediately after. And then another patient after 4 cycles of CoolSculpting and performing Z Wave immediately after the treatment. So to the left on the bottom here is the handpiece that you hold, and to the right is a cartoon of how those shock waves go into the tissue to do their magic. So the pressure waves are transmitted through the skin, and they spread radially into the fat. So this is a video. I'm going to let Michelle talk through how she does it, how many pulses, how long. So this is just a treatment with Z Wave.
Okay, thank you, Dr. Sawyer. So this is a Z Wave treatment to the abdomen. I generally apply anywhere from 3,000 to 6,000 pulses to an area, depending on the size of the area and also the density of the adipose tissue. I customize each treatment by changing the energy, frequency, and the number of pulses. If a patient has very dense adipose tissue, I use a higher energy and a lower frequency.
Okay. So tonight's webinar is about radiofrequency and Z Wave Pro. And we primarily use 2 radiofrequency devices when we're talking about body shaping. Now, we occasionally use others, but when we're talking about cellulite, we're primarily doing, or fat, we're primarily talking about the Vanquish, which is a multifocal radiofrequency device, and then the BTL Excelus Ultra, which is radiofrequency and ultrasound. So our first purchase of a radiofrequency device was in 2010, and since that time, we've really learned a lot about RF. And what we know is that the depth of the heating and cooling is key. And so if we want to heat skin, we want more superficial heating. And if we want to treat more fat, we need a depth of heating that's different than what we need when we're tightening skin. And RF can treat either. So when you're trying to get the skin to temperature, which is language that we use when we're talking about it, the heat has to be delivered quickly and evenly. And if we're tightening skin, we try to get the skin to about 42 degrees centigrade and then keep it there. And the longer that you keep it there, the longer that you're contracting collagen. So devices that don't get the skin to temperature quickly, you're spending all your time just getting the skin to temperature. But with the Excelus Ultra, the improvements that they made when they added the ultrasound really made this device be able to get the skin to temperature, and then so that you're spending most of your time actually keeping it there and contracting the collagen and the elastin. Also, the even distribution of the heat makes the treatment more comfortable. And so if a patient is uncomfortable, we're not going to keep be able to keep the skin or the fat at the temperature that we need to get the desired result. And so if the heat is not distributed evenly, then they're going to jump or move away, and that's going to mess up your treatment. So, and then we also know that if we want to selectively target fat, we need to get it to 44 to 45 degrees centigrade. Another thing that we've learned really with all of our body shaping procedures, but especially with our radiofrequency, is that hydrated patients get better results. And so sometimes we'll keep electrolyte waters in our fridge, and if somebody will question them about their hydration level, and Michelle will wait until they down a bottle of water if they're dehydrated, because she's seen a huge result, a much better result with hydrated tissue. So with the XLIS Ultra, you can see down on the bottom left that the trick is, how to set the device so that you're targeting the tissue that you want to target, whether it's superficial or deep. And the changing the power and the cooling during the treatment allows Michelle to treat deep tissue to superficial just by changing the settings on the machine. And then the BTL Vanquish Me is multifocal radio frequency that has panels that send RF back and forth over the treatment zone. So this device is nice because it has the largest treatment area of any device on the market that targets fat. And so it can run through an entire abdomen and flank region at the same time. So if somebody's looking at doing a whole lot of cycles of CoolSculpting, it may be a smarter move to put them under the Vanquish, because the Vanquish sometimes is a better option for that patient. So this patient underwent actually 3 laser treatments in 2 separate sessions. So you can see that the skin is tighter from the XLIS Ultra and smoother from the Z Wave. And then we also treated angiomas with the V-beam, which she didn't have in the second picture. But this patient underwent 2 treatments and was thrilled. She started kind of late. Looks like it was right before Memorial Day, but by July 20th was looking a lot better. And this is the same patient, just a different angle. We also treated the outer thigh here and hip, and you can see that she got a great outcome there as well. This is a good patient. She's had a great figure to begin with, and so perfecting it was easy. So this is a video of the XLIS procedure, and I'm going to let Michelle talk through that.
Okay, so this is our XLIS Ultra device, which combines radio frequency and ultrasound simultaneously to deliver controlled heating and cooling. I mainly use our XLIS Ultra for skin tightening. I treat each area for approximately 30 minutes with the cooling turned off. I follow each treatment with approximately 3,000 pulses of Z Wave using a much lower energy and higher frequency to treat more superficially.
Okay, thanks, Michelle. So this is a patient who had 4 treatments of XLIS Ultra and Z Wave over 2 months. And you can see that just treating cellulite or just tightening skin by itself would never produce the same result as combining and using synergy here with the 2 devices. So we were able to deliver this result in 2 months, and the patient was thrilled, and you can see that she looks great. Good job, Michelle. So this is just the study that showed that there's maybe even a bigger difference doing Z Wave after Vanquish than there is after doing Z Wave after CoolSculpting. And so this is no massage versus Z Wave, and it showed a 64% improved outcome with Z Wave. So the next few pictures that I'm going to show you are either going to be patients who we did Vanquish and Z Wave, or Vanquish, XLIS Ultra, and Z Wave. So this is a patient, and again, I'll point out, if you look at the dates here, 3/5 to 3/20, and we're able to deliver this kind of result. So that's another reason that we may choose Vanquish over CoolSculpting. It's faster, and patients start out New Year's with great plans to be on a special diet and exercise plan, but we have lots of patients, and I'm sure everyone on this call has patients who show up and they want results before spring break, and it might be February 27th. And so we like to be able to deliver quickly. Now, of course, all of our modalities work better if the patient eats right, but you just can't get a result this quickly any other way, and certainly Z Wave helps make this possible. So this is a patient who underwent 2 treatments. This was another patient that showed up at our office with a very short timeline. And so in 2 weeks, we usually do 1 treatment per week. In 2 weeks, we're able to deliver quite a lot. And this is when we first started using the 3 modalities together. And this was a protocol that Sunil Chulakuri from Texas helped us deliver and came and helped us put this treatment plan together. And you can see that all 3 works very well for skin tightening, for that little bit of bumpiness to the skin, and for fat loss. Michelle, would you talk a little bit about that protocol and how you put those together?
Yes, so we call the combination Silhouette. So we first begin with the Vanquish Me, and we treat the patient for about 45 minutes to heat up the tissue. And then we follow it up with the Exless Ultra for anywhere from 10 to 15 minutes. We found that we get a much better tightening when we combine the 2. And then we finish with the Z Wave for about 3,000 pulses to help flush out everything out of the lymphatic system. And it also helps really with sculpting the patient too, and they see quicker results.
Thank you. So the next 2 pictures are men. This gentleman was also at the gym, also toning muscle, but you can see that in a very short amount of time we were able to eliminate a lot of fat. And this patient just got the Vanquish Me and the Z Wave, and he had 4 treatments. And the other thing about Vanquish is nice, you can treat once a week. So again, Vanquish Me and Z Wave, 4 treatments, a pretty short treatment period, probably 2 or 3 months. Great results. So this is Michelle doing a Vanquish procedure.
Okay, so this is the Vanquish Me, and the Vanquish is radiofrequency that breaks down the fat cells through selective heating. We treat the patient for 45 minutes, followed by approximately 30,000 pulses of Z Wave. The Vanquish actually treats the patient flank to flank, so we get a really nice, even treatment. I generally use a higher energy and lower frequency to target the subcutaneous fat. And the Z Wave has significantly improved our patients' results. It helps reduce edema and discomfort and paniculitis, which is always seems to be a problem with the Vanquish. Before, we had a lot of patients that would come back and complain with that, and the Z Wave has reduced that tremendously with our patients.
Thank you. So you can tell from our discussion that the Z Wave has been a major player in our body shaping practice. And there was life before we had it and then life after we had it. And we've really been able to deliver a lot better results. And I will say one thing about just the speed of the results. So a lot of patients, they struggle with their body image. They struggle with diet, exercise. And having to tell a patient that it's going to take 3 or 4 months before they can see an outcome is really just, in our mind, not acceptable, because the patient in that length of time is going to get frustrated, is going to come off the diet, and become unmotivated. And when we're able to show a result in a week or two, we really motivate that patient to stay with the program. And we all know that anybody that stays with their diet and exercise program is going to do better with all of our body shaping devices. So we're really able to capture the attention of that patient and keep them focused versus before when we would just have to say, oh, we'll see you in 16 weeks and we'll take your after picture. So I feel like that is probably the major difference. Patients are not patient. They want to see results quickly, and anything that we can do to deliver that is going to make the patients much happier. And those kinds of patients spread the word about you. And I feel like that while the Z Wave is not something that patients call and ask for. Now, we have had patients call and say, do you perform Z Wave Pro after CoolSculpting? And we're happy to be able to say yes. But more than that, that positive result more quickly creates a lot of buzz. And patients tell their friends, look what I got done, or they go on that trip where they can't wait to wear their swimsuit, and their friend says, oh my gosh, you look great. And so it really has created a competitive edge in our community. I mean, we all struggle with having a CoolSculpting machine on every corner, or, you know, somebody, you're never the only person in your area, especially if you live in a city that has the technology that you have. But when you have Z Wave, you definitely have an edge. And so these are all of the things that you can use. This is not even a complete list. I will mention that a few patients after liposuction, if they were slow to heal, weren't seeing a result as quickly, we do Z Wave on them, and we have them come in several sessions for Z Wave, and their result comes a lot quicker. So we're able to help other doctors in the area as well as treat our patients. So it's a wonderful complement to an array of invasive and non-invasive cosmetic procedures. It helps minimize downtime, and it maximizes results. And so in my mind, the ROI comes easily via this competitive advantage that you have in your community. So thanks for having me, and we'd love to hear any questions.
Thank you very much for your presentation, Dr. Sawyer and Michelle Alvis. By the way, your before-after pictures are just incredible. Really, really amazing results.
That's Michelle.
Great job.
Thank
I'm
you.
going to take, you're welcome. I'm going to take the screen back, and then we can begin the question and answer portion of the webinar. Give me just one moment. Okay, the first questions are starting to roll in here. The first question is, do you think it's important what order the procedures are done in, i.e. RF first or Z Wave first?
Michelle, you want to answer that?
Yeah, so I always use radio frequency first. The only time, like Dr. Sawyer spoke about earlier, that I would ever use a Z Wave would be before a CoolSculpting treatment, and that's to soften the tissue to get better tissue draw. But the purpose of using the Z Wave after radio frequency is to help to encourage lymphatic drainage after we're breaking down the fat, and also to help reduce edema and also reduce discomfort.
Okay, next question is, are there any therapies you use in addition to Z Wave and RF for cellulite? For example, lotions, potions as a take-home therapy in conjunction?
Yes, we probably about 6 months ago started selling the Elastin Transform body. And so our patients use it after pretty much any skin tightening treatment or body sculpting treatment. So they use it twice a day after Excellus for skin tightening or CoolSculpting or Vanquish. And I feel like it has really enhanced our results. We usually, at that 4-week marker, when we take before and after pictures, we can definitely see a difference. And the patients seem to feel like it is helping with the skin tightening too.
Okay, there seem to be quite a few questions coming in here about your protocols. I'll just go through them here one by one. Can you review your protocol for cellulite alone?
Yes, we have a standard setting that we normally use for the cellulite. We usually will treat the patients twice a week, and we recommend at least 10 treatments. Now, of course, depending on the severity of the cellulite, we may have to treat more. Every patient's different. Some patients we can treat 6 times, and then they'll use their other treatments for just maintenance. And we do also recommend the maintenance treatment. So we usually will treat each area, and an area would be the size of a sheet of paper for anywhere from, again, 3,000 to 6,000 pulses. The energy I usually use for the cellulite is 120, and like I'm trying to think, is there any other questions as far as the protocol?
Yeah, actually, I'm sorry to interrupt you, Michelle.
Yeah, no, go ahead.
Yeah, there's one question that just came in sort of directly related to what you're talking about. It is related to CoolSculpting, but related to this energy. What is the most optimal energy for treating post-CoolSculpting? Also, is 3,000 pulses most ideal?
Well, it really depends on the area. So if we're treating the upper arms, of course, that area, you have to definitely go down on the energy a little bit because you can actually bruise the patient and it's uncomfortable. And I would probably use fewer pulses there, maybe 2,000 pulses for the arms or inner thighs. And it really depends on the age of the patient. If you have an older patient, they're going to bruise pretty easily. Then you will definitely want to go down on the energy and the number of pulses too.
Okay. How many Z waves needed after CoolSculpting?
We usually perform Z Wave immediately after CoolSculpting. I know other offices will treat them once a week after, but it's just more of a time constraint that we have with our schedules. But we usually will treat just immediately after the procedure.
Okay, another question about settings here. Can you provide Z Wave settings for deep and superficial treatments?
Yes. Usually, let me think for a second. Usually, the standard setting I usually will use for the cellulite again is the 120 energy with around 3,000 pulses. And if I'm treating it after CoolSculpting for an arm or something, I usually will go down to 80 as far as the energy and maybe 2,000 pulses.
Okay, thank you. This next question, Dr. Sawyer, how does the combination therapy compare with other technologies you've used for cellulite in the past?
Well, I have a long checkered past with cellulite. I did a fellowship in the year 2003, and I was in San Diego with Drs. Mitch Goldman and Richard Fitzpatrick, and we got every device that came off the press at our office right off the bat. And so I've used a lot through the years. I feel like with cellulite, the result is not permanent. And I feel like if you can offer a good solid treatment that is not really, really expensive to people, that they're going to have to come back every spring before summer and get, treatments again. We rarely have a technology in cellulite that's going to last more than just for that season. So because it is a problem with metabolism. And so I feel like that the Z Wave is the best that I've ever had or seen because the machine is very reasonable and you're able to deliver a great result to patients in a short amount of time and not have to charge them an arm and a leg. There's no consumable cost. The device is so sturdy. I mean, my Zimmer chillers, my Zimmer Z Wave Pro, they are very reliable. And knock on wood, we turn them on, they run, and so it's just a really low cost, wonderful option. The other devices, I never have purchased the really expensive devices for cellulite because I think that I've been in this business long enough to see that there's a lot of hype when something comes out, and then 2 years later they're apologizing for promising, over-promising the duration of the result. So I feel like you need massage with any good cellulite treatment. You probably need some heat, and you've got to be able to stimulate blood flow. And so if you've got that, I think you're good to go with cellulite.
Okay, we have really a lot of questions rolling in for both of you here today. I think this next one may be just looking for a little clarification on the CoolSculpting protocol. For most areas, is 90 joules ideal or 120 for post-CoolSculpting treatments?
Well, it really depends on the patient. Again, anywhere from 80 to 120. It depends on the area. If we're treating a lower abdomen and it's a larger patient and with thicker adipose tissue, then we're definitely I'm going to use probably 120. I've even used more than 3,000 pulses on patients that are larger. And again, a thinner patient where I'm going to go down to 80 to maybe only using 2,000 pulses, depending on the area. Like you can really bruise a patient on the upper arms, inner thighs, and of course the outer thighs you can usually handle a lot too. I usually will stick anywhere from the 120 to 3,000 pulses after post-CoolSculpting.
Okay, speaking of bruising, here's a question about that. Any experience using it for post-profound treatment which causes bruising? Can it help bruising?
We have a profound, and I don't think I would use this on a post-profound patient. They're very swollen, so I understand the desire to do that, but because I do think it could help eliminate swelling, but you're generally on the face and neck you would never do this, but if it's a body area post profound, I think it would help with edema, but I don't think it may mobilize the bruise a little bit more quickly, but I think I'd be a little worried that it would create more trauma to the tissue.
Okay, I have a few questions that are related to frequency. So let me just combine a couple. I'm going to read them both. Would daily be more, less, or similarly effective? And then the follow-up there is, do you have a protocol for when you are doing RF and then Z Wave? Do you treat it the same as CoolSculpting where you only do it immediately, or do you have a maintenance protocol as well?
So for the radio frequency, we usually treat patients every 2 weeks. So if we're doing an anterior thigh, we're going to we'll treat a patient for 30 minutes, and then they'll come back in 2 weeks. And we immediately treat with Z Wave as soon as we're finished with the RF treatment.
Okay.
So, but we do combine them. If we're doing it every 2 weeks, we will first treat with X-Plus, and then we treat with Z Wave immediately afterwards. But I think to answer the frequency question, though, if somebody is just treating cellulite, you could certainly treat more often, especially if you wanted to do just the Z Wave, if they were in a hurry. But when we're doing both together, we usually separate it by 2 weeks. But you can do Z Wave 2, 3, 4 times a week.
Okay.
Yes, but our cellulite protocol is usually twice a week if we're using only Z Wave. If we're combining it with radio frequency, then we can treat once a week, but usually it's every other week.
Looks like our webinar is running a little bit over here. We're about 10 minutes over. Do you have time to stick with us? Because we really have a lot of questions coming in. Could you take a few more questions?
Sure. Mm-hmm.
Okay, now I have a couple of questions related to cost suggestions. What fee schedule and amounts work for you and your patients?
Dr. Sawyer, I'll let you take that one.
So our Excellus pricing is $500 for a body area, and we usually say a body area is an 8.5 by 11 sheet of paper. Now we don't add for the Z Wave. We don't that we do that as a value add for everything unless we're treating cellulite alone with Z Wave. Then we sell a package of 10 for $1,000.
Okay, very good. I have another question about the treatment frequency here. I don't want to bounce around too much on you. Let's move forward. What do patients say about how Z Wave treatments feel?
Patients, they love the Z Wave compared to the hand massage after CoolSculpting. Some of our patients that we treated prior when we were doing the hand massage hated the hand massage, and so they love the way the Z Wave feels. It actually warms up the tissue and makes it a lot more comfortable. We've actually had patients leave other practices and actually come and start treating with us just because we added the Z Wave, just because of the comfort level. So it's a very comfortable treatment, even post radiofrequency. It's very comfortable. Some people even find it a little ticklish. So.
And what difference in results have your patients reported? I think this is referring to if you've had a patient who had a treatment without the Z Wave, and then if they had a treatment with the Z Wave, are they reporting a difference in results?
It's definitely less discomfort. Again, with the Vanquish, we were seeing fewer the petechiolitis and edema. A lot of times with the Vanquish patients, we would have a lot of soreness afterwards, and they never complained about that since we've incorporated the Z Wave. Same thing with the CoolSculpting. They're seeing faster results, and it's more comfortable after the treatment. And usually, even when I'm doing skin tightening, the patients feel like they can see a result quicker, so the skin appears smoother and tighter.
Okay. The attendees have been very persistent about the questions about frequency. We may have to go back to a couple of those questions. But first, let me ask you, are these devices contraindicated with sun exposure?
No, there's no, it's not laser light, so there's no reason that you can't treat a tan patient.
Okay. What is the longest gap in treatment frequency that you would allow? For example, would once a week work as well as 2 to 3 times a week?
When treating cellulite or
that's
just
not specified. I would assume it's a RF and Z Wave. For cellulite, yes.
So I feel like we see better results. We want to treat the patient closer together, so anywhere from 1 to 2 weeks. Occasionally, we'll have a patient that lives out of town, and we'll let them come, every 3 to 4 weeks. But they're going to see better results, and of course, quicker results if they're spaced at least a week or 2 apart.
Let's take just a couple more questions here because I know I've kept you over already now 15 minutes. So how many Z Waves do you typically recommend post RF per week?
And normally, if we're treating with radiofrequency, we treat at the same time. So they usually don't come back after and do just the Z Wave unless we're treating cellulite. So if it's just for skin tightening or smoothing, we will treat at the same time with Excellus.
Okay, wonderful. Last question that we'll take here. And what is the difference you've seen clinically between RF alone versus RF with Z Wave? You may have touched on that in your presentation a bit, maybe a little elaboration.
Yeah, we definitely have seen a quicker improvement and a better improvement. And that's a little harder to explain, because when we see better results with CoolSculpting, we know it's the massage. We know, we understand. With the skin tightening, I think it's just a blood flow thing. I think the more blood flow, because anytime we're using any laser or RF device, we're creating a controlled injury in the collagen. And so with more blood flow, you're going to get better healing and more growth factors in the area. So I think it's just a blood flow issue, but certainly with Z Wave, we've seen every result get better from anytime we use it in conjunction with any of our body shaping.
Okay, well, thank you so much for that discussion and for taking a little extra time with us here, Dr. Sawyer and Michelle Alvis.
Thanks for having us. We appreciate the opportunity.
And if anyone else would like more information about Z Wave, Z Wave Pro, and Z Wave Q, please visit Zimmer MedizinSystems website at www.zimmerusa.com. You may also visit shop.zimmerusa.com to purchase accessories and marketing materials for your Z Wave device. This concludes today's webinar. Thank you very much for attending. A recorded version of this webinar will be emailed to all attendees so that you may review any of this information at your leisure. Good night.